Meet Chelimo Njoroge, a Kenyan mother of two whose breastfeeding journey has been anything but ordinary.
I found that I was producing a lot of breast milk, and this started 4 years ago with my son. And yes, when I got my daughter last year, I realized my breast milk supply was much higher than usual. And that journey has made the breastfeeding process enjoyable, because I have not only been able to provide breast milk for my children, but I have also been able to donate to people close to me.
On the other side of the coin is Marianne Muthoni, a mother who struggles with low breast milk supply due to health issues.
I had actually nipple dermatitis. So anytime baby would latch, now became a nightmare, and you have to breastfeed the baby.
And that was her cue to turn to Chelimo for help.
I think I've done about 4 collections from her, and each collection is about 12.5 to 14. So I think by estimate, we've received like 60 liters, and that is not an easy feat.
Recent data from the Kenya Ministry of Health reveals that 3 out of 10 mothers in Kenya do not breastfeed at all, relying solely on bottle feeding. This isn't ideal. As the WHO says, breast milk provides the ideal balance of nutrients for infants, protecting them from infections and promoting healthy growth and development. Milk donation, a relatively new idea in the country, is a way to overcome this issue.
I was at peace. You have first mental peace. It's somebody you know. It's somebody who has done it before. So even the baby who she'd fed or nourished earlier is alive and kicking. So my mental state was at peace. My pocket was happy, My baby is healthy and thriving.
While milk donation is a possible solution, unfortunately in some communities, the fact that a mother might need such assistance is looked down upon. Muthoni says this is something that needs to stop. Only then can the true advantages of the donation scheme be realized.
So there's no shame at all in receiving help, because first and foremost, your mental state, you'll be affected that I can't provide milk. Then your child is hungry. Then you become angry and frustrated. Then you go into a state of depression, and there's actually help out there.
Kenya is one of the countries, together with South Africa, that has a human milk bank. However, in Kenya, gaps in supply and infrastructure limits its reach. According to Chelimo, there is need for a national breast milk reserve, because even with milk donation, care needs to be prioritized.
But there's a lot of things you have to consider. Where is the milk going to be stored? Is the person you're donating to, do they have the information on how to use the breast milk? Because there's a way you have to thaw it. There's a lot of guidelines on how breast milk is handled.
To address broader breastfeeding challenges, Kenya recently introduced the Breastfeeding Mothers Bill of 2024. This landmark legislation mandates lactation rooms and breaks for nursing mothers, particularly supporting those in the informal sector. For now, this private donation scheme is working miracles for some mothers. Dina Matengo, CGTN.